My name is Tori Sills, and I'm here to present my Practicum project. So, for the project for the semester, I decided to focus on colorectal cancer newly diagnosed patients. I work in an oncology clinic as a nurse navigator, and currently I work with breast cancer patients, but our clinic decided to bring in colorectal cancer patients for nurse navigation. So as a nurse navigator, my role is to educate patients about their diagnosis and help facilitate appointments for those patients, be their main point of contact, and just help them through their diagnosis. So with breast cancer patients, nurse navigation has been part of that breast cancer diagnosis for a long time. Our previous nurse navigator had been the nurse navigator for 12 years with breast cancer patients, and even in other clinics, that has been something that has been part of their clinic. But nurse navigation for colorectal cancer patients is something that hasn't, and we even found out that there's not anyone within the Texas oncology system that has a nurse navigator for colorectal patients. So they found a need for those patients to have a nurse navigator. So we started introducing that in probably a couple months before I started the class. And so it's brand new to even the entire clinic. So I felt that for my project I could use that, and I decided that I could create some kind of education that I could give these patients, because there's so much out there on the internet, and sometimes it can get overwhelming with all the information. So I wanted to create something that I could give them from Texas Oncology, and maybe even a different type of media. So like a video that they could access at home, and even their family could, of me presenting that information to them. So my objectives for the project was to, one, obtain different information from different resources and compile all that information together into one. So, looking on sites like American Cancer Society, National Cancer Institute, putting all that information into one cohesive whole, and then making a video, PowerPoint, handout, anything like that for these patients. My second objective was to integrate that into the clinic, and so I'm going to kind of go over what I was able to do and what I was not able to do. So it took me the majority of the semester to go through everything and all the information that I had. I read a textbook that was full of information on colorectal cancer, and even how to integrate multidisciplinary people. So meaning colorectal cancer is treated with several different types of treatments and physicians, and so this book was about how to integrate all of that together as a nurse navigator. And so through that and different continuing education courses, I compiled all this information together. I was not able to make an actual video of the information and post the information for patients to actually use, because our organization is very big and we have our own media team that puts together educational information, and being associated with a company, it needs to be approved by that company, and so that's something that's going to have to be worked on, and I hope to do that in the future. So what I was able to do was put together a handout, which I have in front of y'all, and a PowerPoint, which I'm going to kind of go through just to kind of explain colorectal cancer. So colorectal cancer is the second most common cancer in women and the third most common in men, and it is the second leading cause of cancer death in the United States. 1 in 23 men will get colorectal cancer, and 1 in 25 women will get colorectal cancer. And so it's very prevalent even in our area, and it's very extensive treatment, and I'll go through some of that treatment and why a nurse navigator in education is so important. So a risk factor for colorectal cancer, a risk factor is something that increases your risk for cancer. And so there are modifiable risk factors and non-modifiable risk factors. So modifiable are things that you can change. So overweight, physical inactivity, a diet high in red meat has been shown to have an increase in risk for colorectal cancer, smoking, and alcohol use. And that alcohol use is as little as 2 drinks a day for men and a drink a day for women every day, and that can increase your risk. Non-modifiable risk factors are things that you cannot change. So that would include your age. So for anybody, as your age increases, your risk for cancer increases. If you have a personal history of polyps that are considered high-risk polyps, so meaning there are certain polyps that are more at high risk for colorectal cancer. So if you have a history of those, that can increase your risk for colorectal cancer. If you've had a history of a colorectal cancer, so you've had colon cancer or rectal cancer in the past, you're at more of an increased risk for cancer in that area again. Inflammatory bowel disease can put you more at risk because it's an inflammatory state, so that constant inflammatory state can put you more at risk for cancer. And then genetics can be involved, so if there's a mutation in your family, that can put you more at high risk for colorectal cancer. That can increase your risk. African Americans have the highest incident rate of colorectal cancer, so if you have that ethnicity, that can put you more at high risk, and then type 2 diabetes can also put you at more high risk. So what is colorectal cancer? So it's cancer that starts in the colon or the rectum, and most colorectal cancers are adenocarcinomas, which is cancer that starts in the cells that make mucus to lubricate the colon and rectum. So just a little bit human anatomy for you. So we're looking right here at the large intestine and the small intestine, the rectum, and the anus, but I'm more looking at the colon and the rectum. So colon anatomy, you have your appendix. This is the small intestine that's going into the large intestine. So you've got your cecum, the ascending colon, transverse, descending, sigmoid, and then your rectum. So a colon is made up of different layers. So most of the time your polyps start in the innermost layer, and then they grow. They can grow into the colon, and they can grow through the colon out into the surrounding tissues. So signs and symptoms of colorectal cancer can be rectal bleeding, changes in the bowel. You can have a rectal mass that you can actually feel. If you have a family history of colorectal cancer, depending on how extensive that family history is, you can be more at risk for colon cancer. Abdominal changes, so some people feel bloated, pain, and then anemia, so meaning low blood count. So some patients may feel fatigued. They go in and get blood work, and then they find out that their blood levels are low, and then that needs to be investigated as to why you're having low blood counts. So the way we detect and diagnose colorectal cancer, you can do different exams. So physical exam, a lot of the times the gastroenterologist will do a colonoscopy or even a proctoscopy, which is just the beginning of the colon instead of going all the way through the colon. If they see something abnormal like a polyp, then that needs to be either biopsied or completely removed if they can. They can also do, there are different staining tests that can be done called MSI and MMR, which that's kind of going into a lot of detail, but that helps with treatment. They can do a CT scan to show the extent of disease, if there's disease anywhere else. An MRI, which shows soft tissues a lot better and can really show how big the tumor is and how far extended it is into the colon or surrounding area. Blood test, you can check for the CBC, which will show if someone's low in their blood, which we talked about earlier. And then liver enzymes, they can be high if there is metastatic disease to the liver, but that will be usually a later sign. And then tumor markers. So tumors make a special protein that can be detected in the blood. And so sometimes you can do a tumor marker blood test to see if someone has cancer. So the staging is ultimately determined by the physician, and it involves the tumor size, lymph nodes involved, and the if there's any metastasis anywhere. And a lot of the times there's a clinical stage and a pathological stage, and so they usually stage after surgery when they know more information on the lymph nodes. So treatments, different treatments. There are local treatments and then there are systemic treatments. So local treatments can consist of surgery and radiation, and then systemic treatments can consist of chemotherapy, targeted therapy, and even immunotherapy. So what that means, there are different surgeries for colon cancer, and they are listed there on the handout. So there's a local excision, which is just removal of the polyp. And a lot of the times, if they're smaller, that's all that needs to be done. There's a colectomy, which is partial removal of the colon, and a total colectomy, which is removal of the entire colon. With the colectomy, they always remove, the standard of care is to remove at least 12 lymph nodes, because we want to make sure that the cancer hasn't spread to the lymph nodes. So surgery for rectal cancer, there's kind of similar to colon cancer, but it is lower down in the colon, and so there's a little bit more options and more extensive options as the staging goes on. And so ultimately the surgeon has to discuss that with the patient, depending on how extensive the tumor is, how big it is, how far up it is. There can be anywhere from just removing the area to having to remove the entire rectum and the sphincter, which would end up in a permanent colostomy. So when talking to patients about surgery, especially in navigation, it's important that they understand from the surgeon what surgery that they need to have, because ultimately some of them unfortunately can end up with a permanent colostomy, and that's very challenging mentally for them to deal with in the long run. So radiation, not everyone needs radiation, and not every colon cancer needs radiation. So ultimately that's determined by the surgeon and the medical oncologist and the radiation doctor if you need radiation. But what radiation is it's a local treatment, so it treats the area of concern and anything surrounding. So if there's maybe lots of lymph nodes or different concerning areas, that radiation can treat that local area. So that's just general information about colon cancer. And my goal for the project was to be able to create this and actually hand out to patients. However, I wasn't able to do that since I worked for a big company. I hope to in the future to integrate this and work with our team to make information. We're still learning, we're still deciding and figuring out how to navigate colorectal cancer patients, considering we're the only ones in the Texas oncology system that even has a nurse navigator for colorectal patients. We are still trying to figure everything out and how we best can help patients. So